Hi there, John Farahmand from Balanced Physical Therapy and Human Performance Center. Today I want to talk about something that we hear a lot of questions about in clinic. Why is my knee making noise? Why does it sound like sandpaper when I turn my head? Why does it sound like a bag of rocks sometimes when I squat down, etc., etc., etc.? That noise, we're just going to call it noise, that we hear is called CREPITUS or crepitation. I've taken some notes on the board here so you can see how it's spelled. CREPITUS, crepitation. Let's just call it noise. Some of you may experience this when you turn your head and it kind of sounds like, the sound of grating, that kind of stuff. Some of us might experience this when we stand from a chair and we can kind of hear or feel our knees crackling, etc., etc. In the morning, when you get out of bed and you walk to the bathroom, snap, 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 and you can feel stuff down around your ankles and your feet that's sort of popping, like the little plastic covers you get in a box of See's candy. Sometimes it sounds even like that, like a big pop, and you're going, whoa, what in the world was that? Is it bad? Is it not bad? That's kind of what I want to talk about today. So the first answer is not necessarily, okay? There's a few different types of crepitus that we'll talk about, but in general, that noise is the sound that you hear between bone and cartilage, okay? For example, when I turn my head, tiny bit of crepitus when I turn my head that way to the right, itty bitty, and I can hear it. Nobody out here can hear it, but I can hear it. That's probably some of the cartilage and bone moving past each other in what are called the facet joints of my neck, where each of the cervical vertebrae are stacked on top of each other. Totally benign, not a big deal. I have no symptoms whatsoever, and largely I'm just going to ignore it. But let's say you got a fracture. God forbid you fall on an outstretched hand and you have what's called a Colles fracture, distal radius fracture, and the two broken ends of the bone are moving against one another and you hear grinding, okay? Bone crepitus, not good, okay? Not likely that you're gonna enjoy that sound or that feeling at all, okay? Joint crepitus. Joint crepitus can be heard, and as therapists in clinic, we palpate it a lot when we have, let's say, the shoulder joint, and we've got your scapula, your shoulder blade fixed, and we're passively moving the humerus, the bone in your upper arm, in the socket or the glenoid of the scapula, and we can hear noise, okay? That's a joint moving across another portion of a joint. Not necessarily pathological. Sometimes we can feel it with our hands. Sometimes we can hear it with our ears as well. Bursa, the little fluid-filled sacs that are inserted all over our bodies to help decrease friction and absorb shock against bony prominences and things like that. Sometimes the fluid in the bursa can develop, fibrinous particles inside of them that can create noise, okay? And sometimes that's a click, a crack, a pop, a snap, etc. And largely not necessarily pathological. Sometimes they can become pathological. Sometimes you're going to require physical therapy, anti-inflammatories, perhaps injections, and in the most extreme conditions that I've seen over 25 years as a therapist, bursectomy, surgical excision of a bursa. I've only seen a very small number of those across 25 years, thank goodness. And then lastly, tenosynovitis. Our tendons attach our muscles to our bones. Each of our tendons has a tendon sheath around it, a covering within which the tendon slides. Sometimes there's inflammation in that tendon sheath that creates noise. There's crowding in there and your tendons kind of snap, okay, when that sheath has inflammation inside of it. So the tendon sheath or synovium, okay, and the tendon, teno, gives us tenosynovitis or tenosynovitis, tomato, tomato, whatever you want to say. But that's another source of noise in our bodies sometimes. So largely, when you hear snap, crackle, pop in your joints and you're not experiencing recurrent pain and recurrent crepitation associated with pain, it's not likely pathological. But if the crepitus is in the same exact place repeatedly with the same exact movement and it's uncomfortable or painful, you may have a problem for which you need to see your physical therapist. Thank you very much for listening. I appreciate your time.